Alrighty. My name is Anthony Handy.
And I'm Justin Clifford.
I don't know if you can hear me or not.
Yeah, I
We're
can.
doing
We can hear you.
Thanks, Justin. All right, we'll be doing EMTALA. Next slide. And the EM is the emergency medical treatment, which was 86. It would be the Anti-Patient Dumping Act. One thing that brought this act around, hospital at that time would, because they were uninsured or they were just pulled out. LA, the COBRA Act, we were part of it. One in needs to be
I'm sorry, Anthony.
is
Sorry, Anthony. Can you hear me okay? Sorry, you're breaking up pretty bad. Justin, is he breaking up for you as well?
Yeah, he is.
Okay. Hey, Anthony, if you can hear me, let me have you try and hide your video part, and that might help with the streaming. You're just kind of breaking up pretty bad, and I want them to be able to hear you. There should be like a turn camera off option for you. That might just help it a little bit. Okay.
better.
That might be better. I heard you that time. Sorry about that. You can go ahead and continue.
No, you're good. Thanks for the heads up. So, this act was put into the EMTALA wasn't the first act of its kind. There were several others that were put into place. One of them being the Hospital Survey and Constitution Act 46, or commonly known as the Act, which was established federal guidelines for emergency medical care at certain hospitals, and many state laws were also booked mandating non-discriminatory access to emergency care. One thing we're looking at, just some definitions. Dumping is transferring patients who are unstable to a different hospital. And wallet biopsy to see if the patient had means of paying. If not, then they weren't treated. Alrighty, next slide. All right. More of a defined is the denial of limitation and this provision of medical services to a patient for economical reasons and the referral of a patient elsewhere. One thing that was looked at during this time, just before this law was passed, was like tons of transfers that were happening where either they were minorities or unemployed. Reasons for transfer was lack of insurance, and that was in 87% of all cases. This time frame that we're looking at is between 1982 and 1986. 6% of patients who were transferred were only done so with written consent. One thing that was looked at was medical service patients who were transferred were 2 times more likely to die than those who were treated at that same hospital they were being transferred to, just due to the lack of them being unstable during transfer. So we're looking at, most of these stats are coming from Cook County Hospital in Chicago, but this wasn't just happening in like large cities, it was happening all over the place. In Dallas, their transfer rates from 1982 were 70 per month. And then in 1983 was over 200 plus a month of transfer rates for patients, just due to patient dumping. Next slide. Froze.
I could take it.
Oh yeah, you can talk for a little bit. That'd be great.
So this next slide. Basically, when someone comes into the hospital for emergency care, the hospital must provide appropriate medical screening tests if determined if any emergency medical conditions exist. If so, they either have to stabilize patients' conditions or transfer patients in accordance with the MTLA law. They have 3 distinct duties, basically, that they must follow and put in place in each hospital, and that's they must perform an MSE on any person who comes in and requests care to determine if an EMC exists. If EMC exists, hospital staff must either stabilize that condition to that extent of their ability or transfer to it with the appropriate abilities to do so. Hospitals with specialized units are required to accept transfer in need of special treatment if they have the capacity to do so. Basically, if the hospital is able to treat them, they must treat them even with or without insurance. And I don't know if you have anything else, Anthony, on that one.
Just a few of them. Just so they know, MSCE is medical screening examination, and then EMC is emergency medical conditions. Just so they don't have any confusion there.
Yeah.
But no, you're good outside of that.
All right, next slide. So the people that enforce this law are the the Healthcare Financing Administration, and they take care of Medicare and Medicaid. They oversee EMTLA enforcement as well as various court decisions. So if a hospital breaks a law, they are to just oversee that decision that the court makes with that hospital and be able to make sure that they are following the court mandated. The EMTLA is virtually applies to all aspects of patient care in the hospital setting. Anything that happens in the hospital is done through EMTLA, and they have to be able to keep a record of everything that they've done. All the physicians should be familiar with its general requirements. So before a physician works at a certain hospital, they have to be familiar with the laws in each state, because the EMTLA law is different for each state, including Idaho. And that's what the next slide should be talking about. So next slide. Yeah, the EMTLA in Idaho. So Idaho hospitals with emergency departments are required by EMTLA to follow certain guidelines. If the guidelines are not followed correctly, then they can be penalized through money or any other court decision that is decided. Some of the guidelines they must follow, and these are only 2 out of I don't know how many I found, but they must post signs in the hospital. So if you've ever been to a hospital, you've probably seen signs around listing your rights as an individual who is being treated at that hospital, and they must be able to treat women in labor. And then they also have to keep a medical record, or they have to maintain medical records related to transfers of individuals between hospitals or other facilities for up to 5 years before they can disregard of them. Next slide. So this is just something I kind of found while researching, but with the Affordable Care Act that we have in place now, it's more of for people that don't have insurance, and it's to help other people, but EMTLA is still in place because tens of millions of Americans are still uninsured or underinsured, even with the coverage expansion of the Affordable Care Act. So even noticing the Obamacare was taking place the last few years and being able to help people get insurance, they still were able to keep this in place. Oh, yeah, keep it in place to be able to help those people that are underinsured through it. Because most insurance companies nowadays don't pay for the full coverage of hospitals. Also, the EMTLA was the first federal legislation established as an affirmative right to health care before the Affordable Care Act. So before the Affordable Care Act was put in place, they had this. This was the only law that took care of health care. And it was in place since 1986 when President Reagan put it in place. Next slide. And those are our references. That's it.
All right. Good job. Very good. Let me have you guys both make sure you're unmuted, which I think you are. And let's do a quick question and answer, and I'll let you go. So very good. EMTLA is obviously a big deal. One thing I like to do is simplify things down a little bit. So obviously there was a problem that was recognized, and there was a solution to that problem, and then there's an evaluation of how we feel like that problem has been solved. So let me have one of you go ahead and share with me, just in simplest terms, when we're talking about the EMTLA or the Aetna, what the problem was presented, how it was tried to be resolved, and then the other person go ahead and share with me if you feel like the resolve has actually helped improve the problem. So in very simple terms, let's have you go ahead and give it a shot there.
The problem that I believe was the fact that patients were going to receive care but being turned away due to payments, not being able to pay. And what was the other question?
So what was the solution? I guess the law that was passed.
So the law that was passed was if a patient goes in for a service, whether it's in the emergency department or whatever department they're in, they cannot be turned away due to their inability to pay or not. And if the hospital didn't have the means to condition or to do anything about it, they had to stabilize that person before they could transform, thus just making it so during transfer they were less likely to die.
Okay, and then Justin, do you feel like it's a good solution? Do you feel like it's working? Why or why not?
I think it is working. I mean, I think there could be improvements because in the healthcare system there always could be improvements. But I overall I think it's working. A lot of people are getting the healthcare they need nowadays because of it. I'm even noticing they don't have insurance; they still are able to get the treatment that they need. Now, I don't know if all hospitals across the United States are always following this. I'm pretty sure there's some hospitals that don't, but for a majority of the time, I do think it's working in the United States.
Okay. Well, very good. Thank you for sharing, you guys. Great presentation. I appreciate the time and effort you put into it. Anything else you want to add before I let you off?
No, I think I'm good.
Okay. Thank you again. Enjoy the rest of your Monday.
All right. Thank you.
Yeah, you bet.
Thank you.
Talk to you later.
Have a good day. Bye.